I'm excited to begin, and I'd like to introduce Helen Walthall, who is going to present doing research and demonstrating a tool for the research to help allied professionals in their work. Thank you, Helen.
Hello and welcome to my session. My name is Dr. Helen Walthall. I'm the Director of Nursing Research and Innovation at the Oxford University Hospitals Trust in Oxford in the United Kingdom. I'm a nurse by background, but my remit within my role is to explore research, capability and capacity for nurses, midwives and all allied health professionals that are not medical colleagues. So today I've been invited to do a session called Doing Research, Tools to do Research for Allied Professionals. So why is research so important? There is a huge amount of evidence in the literature that is telling us there is a really strong association between the scientific basis of healthcare interventions with quality care, safety and cost effectiveness of care we deliver to our patients and clients. None so was that more evident than during the COVID pandemic. If we think by January 2020, the COVID pandemic was gathering pace across the world and no one had addressed or seen the virus prior to that time period. And by 5 or 6 months later, there were a number of vaccines that were already in clinical trials to identify how effective those vaccines were against the virus. On top of that, there was a huge amount of clinical research that was being undertaken. One such example is the recovery study that was commenced in Oxford, led by the Oxford University researchers and moved to 181 countries globally, that really explored the mortality and morbidity of patients with COVID to try and reduce deaths and to reduce admission to critical care areas. And through all of that research, we have managed to keep a cap on the COVID pandemic. And unless the research was there and research was evident to move care and practice forward, we would still be in the depths of the pandemic. So we've seen that research is important, and we saw how important it was during the COVID pandemic. But actually, why should we do research? Most of the research, the vaccine, is from scientists. The recovery trial was from medical colleagues. So as non-medical colleagues, why should we do research? Well, the key point is we play a very critical role in meeting health and social care challenges that are required for global health concerns. Such concerns are cancer, cardiovascular disease, diabetes, motor neuron disease, etc. These are key health concerns that have a global perspective. And what we need to do is be able to deliver the best care possible for our patient group. What is important is people are aging. We are in an aging population. We are managing patients with complex chronic diseases, and acute episodes of these complex and chronic diseases is key, none more so than motor neuron disease. So I've acknowledged that research is really important. I see that I need to do research to inform the care that I'm delivering to people, but how on earth do I do research? How do I get into research? These are just 10 top tips to enable you to get started within research. Firstly, seek out researchers and seek them out in your field of motor neuron disease. You can search the nurse leaders in your local area, you can search your allied health professionals in that local area, but also nationally and internationally. Look at who are the leading people in motor neuron disease and seek them out, send them an email. Researchers are in the game to be able to disseminate research and disseminate their findings. They would love to hear from people that were also interested. So don't be afraid, send that first email. And then actually look in your own organisation. Is there a research mentor that you can link into in your own organisation? So is there someone you could get advice from, bounce ideas from to help you on that journey. Also, attend research seminars. Are there research seminars online that you can link into? And now with the pandemic, a lot of sessions have gone online that you can be in at any part of the globe to be able to attend, often free and no charge. The only issue is your time zones. If you were sitting in one in Oxford at 9 in the morning, potentially it's 2 in the morning or 2 in the afternoon, depending where you live. But actually attend research seminars that may not be about what you want to learn about. They might not be about motor neuron disease, but what is quite key is you learn about how they approached a problem and you learn how they use research to find answers to that problem. So research is very generic. It's just applied to different clinical specialties. So once you can see how someone may have addressed a problem that they'd identified in another chronic illness such as COPD, then you can think, well, how does that apply to my motor neuron disease population? Also, build on work that you've undertaken in practice. Through most of our work, we have to undertake quality improvement projects, audits, evaluations of the care. These are essential building blocks for research skills. So as an example, to develop audit, you need to be able to manage data, you need to input data, you need to analyze data. You need to ensure the data collection tool is a strong enough tool to enable you to collect the data that you need. You're answering a question. So what is really quite key is that you are building on blocks that you do in your everyday practice to recognize these are research skills and tools that you can move forward. Another key person in your organisation is your librarian. Your librarian will teach you and help you to learn skills that are essential in searching for the literature. It is really key that we know what the evidence base is before we start any research. A question may have already been answered. If it's answered, it's not ethical for you to do further research. But if it isn't answered, then you've identified a gap and you know that your research ideas are required because there's no evidence about that particular topic out there for you to build on. Also, a number of organisations have journal clubs whereby colleagues come together to critique articles and to really look about what the evidence is and whether we could implement that evidence in practice. So seek out, see if there are any in your local area. If there aren't, get some like-minded colleagues together and set one up. Get the ball rolling. So the other thing to think about is in organisations, including hospitals and universities, there are a number of research groups that tend to have unique niches. So seek out whether there are any on neurological diseases, any on specifically on motor neuron disease. Seek them out. Go and ask if you can join that group. Go and listen to the researchers in what they are doing currently in that space. What is key for any research is to be able to collaborate and network. It's much harder now that we're living in a bit of a virtual world, but what is really key is that you find people that are similar to you and you link into them and they can help you achieve your goal. Try and publish your work. What you have to say is important and get yourself out there and known so other researchers can pick up you and see you're that like-minded person and they will contact you. This is not an easy journey and often people are put off, but you need to develop skills for resilience and determination to make this happen for you. Unfortunately, there are quite a few barriers people come across by doing research in clinical practice. These include the culture of the environment. So the culture that your organisation is quite key to see whether this is going to work for you, whether you find like-minded people. Support from your manager, your line managers, is also quite key. If they don't understand what you're doing, why you want to do it, why you want to attend seminars or develop a clinical research profile, then you won't get the support. Often you have to educate your line managers about the importance of research and research career pathways. Often the barrier is our own knowledge base. People often did research in their undergraduate programs. If they didn't go to graduate school, they very often haven't built on that knowledge base. And as you move into a clinical role, those skills are often more diluted because you're not using them all the time. What we really need to look at is career pathways. So if I want to do research and clinical practice, how do I do that? What pathway is there to enable me to marry clinical and research together in one role? Often for people that aren't medical colleagues, a huge issue is resourcing and funding. Where do we get funds to enable us to do the research? Often people find there are no role models in practice, so it is really difficult for them to identify who to go to get that support. And very often educational and clinical organisations do not work together to support each other moving research forward. And so finally, what you really need to think about is you, research, and the questions you need to ask yourself. What are the questions that you're coming up with in practice? What questions do you have? What do you do about answering them? Where do you go? What career choices do you want to make? And how do you make these happen? And how are you going to be proactive? Thank you for listening and taking the time to listen to this seminar, and I'm really happy to answer any questions. Thank you.
So Helen, thank you so much for your presentation. That's kind of really thought-provoking, and I think it's getting us all thinking about questions we have in practice and how we can kind of implement kind of research ourselves. I think one of the key things for me, you mentioned about resources and funding. Do you think every single research project we do really requires funding, or is it something we can do in our own work and our own time?
I think that's not an easy question to answer. I think on one side, all of us in our roles need to undertake those things related to how we improve our care. So quality improvement projects, audits, evaluating our service. And I think all of them should be part of our everyday jobs. And so actually, if we're looking at resourcing that separately, then actually, no, I don't think we should. I think there needs to be support from the management team that is a key aspect of your job, and you have that job planned into your working week so that you're able to do those sorts of aspects as part of your job. However, if you're looking at doing a pure research project, I think what we need to identify as professions is that research takes time and resources. And actually, if we do it on top of our day job, one, we won't do it well because we haven't got the time and the resource to do it. And secondly, we're not seeing it as that is what we should do. We are getting research agenda out there, but we're saying we don't need any time or resource to actually do it, which I think is sending the wrong message. Because
what we're used to, isn't it? We're often
doing it is what we're used to. And I think it's the easier thing to do than spending time applying for a grant and then trying to work through the grant. But actually, I would say it's probably not the right thing to do, because the right thing to do is to acknowledge this is a really key question. We need to involve patients and public in that question and in that research. And we equally need to resource them to do that with us, rather than expect them to do that in their own time.
Yeah, thank you. And Amber agrees and says, thank you, we need to band together and we need to be doing more. She's appreciating your comments, really. And I think, personally, I thought of, there was a question and I came to you with my question and say, why is it that many of the patients with that we look after are constipated? great question. And then, we went away and we actually did a research project. So we was kind of presenting the poster today, which is a bit of a plug, but it was developing, and you did help us, and we did get funding from the association to help us with that. So it's kind of possible, and I like this presentation because it's hopefully encouraging kind of everyday working people really to think of the question, the bigger kind of questions, and to kind of do their own projects, really, because it is incredibly rewarding as well. And just to be able to go into a topic in great depth is very exciting.
I think there's a couple of things to pick up that you've just said. I think what is really key, we as clinicians are in a position where we're the ones that know the questions. We are working with patients every day and their carers every day. And so very often we are in that environment that sees the question emerge from practice. But what is really quite key as clinicians is that we do not impose that question on our patients or their family members. We use them as partners within it. So we may well come up with a problem, but actually if the patient or the carer doesn't see it as the problem, then it's not going to go anywhere. And so I think it is really key that we see that our partnership that we are often undertake in self-management and management of patients, particularly with long-term conditions, we are about a partnership model. We need to take that partnership model into research to make sure that the research is relevant to the actual participants of that research, rather than us imposing that on them.
Yeah, I'm going to put my glasses on because there are a couple of questions that have come through. One from Kathy is saying, Helen, would you recommend benchmarking with similar organisations in different jurisdictions with other organisations? Is that a useful thing to do?
I think it is absolutely the useful thing to do. And certainly, I don't know where from around the world you are, but in the UK, what tends to happen is people work with their local organisations, and actually the local organisation may not be the one that you align your research areas with. It may be someone that's 200 miles away. And actually what is really key is in clinical practice, we need to partner with university and researchers, but we need to align with the right ones. And so benchmarking where the colleagues are and the research profile is really key. And then once you've done that, you know who you then want to work with and who you then want to send that email to.
Yeah, no, that's great. And there's another question from Sarah Feldman, and she's saying, is there a way to find out whether funding for AH research is available?
It depends what country you're in. So most countries globally have separate pots of money for different types of research. And so in America, they have the National Institute of Research. In the UK, they have the National Institute of Health Research. And so those national bodies tend to have national funding that will support any clinical specialty and any clinical profession. But also what is quite key, in particular countries, there are pots of money that are for charities related to the area that you are wanting to research in. So as an example, there may well be a carer charity that is quite key in developing a certain part of research that would work with you and help you fund, as opposed to there is something in the UK, there's something called Hospice UK, which is a charity to support hospice. And they aren't malignant disease only, they're about non-malignant disease. So you could go to them to look at how you could work with them and put in a research to support people at the end of life, not necessarily just in a hospice, but hospice at home or a day hospice. And so it's worth tapping in charities as well as national government funded bodies, because they offer very often non-medical clinicians, they offer the first stepping stone into getting a grant.
Thank you. That's really, really helpful. And I hope, and I'm really sure that that's really inspired people to think about their own practice and what they can do to research. In the question and answer box, there are two questions, one from Amber and one from Rod. And I wonder if you'd be able to kind of answer those, because we just don't have time to answer them. If you're able to answer them
Yes,
online,
I
that
will
will
do.
be perfect. And do keep an eye on the chat, because there are questions there too for you. And there are lots of comments about how you've inspired people to think about the questions. So thank you very much, Helen.
Thank you.